Thank you very much for your participation. And now, I would like to introduce you to Dr. Radha Sumariva, who will officially introduce today's program.
So my name is Radha Sumariva. I'm a periodontist, and as some of you know, I represent two organizations here today. I'm a co-founder and president of the Russian American Dental Association. I'm also a board member of Alpha Omega Foundation and board member of the New York chapter of Alpha Omega Dental Fraternity. There are a few organizations that make today possible, and I just wanted to briefly mention what they are doing. First, Russian American Dental Association, we are 501c3 nonprofit organization, and we function as a professional society, organizing various kinds of continuing education activities, as well as have community projects. And our two major community projects are oral cancer smoking cessation, where this project also has a very exciting and very popular kids branch. We have annual anti-smoking art contests and young musicians for Smoke-Free Planet movement. We would love to see you at some of our events, not hoping for all, but at least at some. And we would love for you to spread the word about all the exciting stuff we are doing. Another great project we have is Special Care for Special Needs, which raises awareness of the special needs community challenges and also helps overcome these challenges. And one of the projects that we partner with Alpha Omega as part of this is Building Bridges Conference. We are growing, and we are really looking forward to the third one next year. And again, if you have any interest in helping us putting together the conference or helping with raising awareness of special needs community challenges, please contact us. You know how to find us. Another organization the organization that brought us here today is Blue Card. The mission of the Blue Card is to provide direct financial assistance to needy Holocaust survivors. The Blue Card is the only organization in the United States with the sole mission of aiding Holocaust survivors, which provides financial assistance on a monthly basis as well as for emergencies, such as medical and dental care. As part of the White House call to action to provide pro bono dentistry to Holocaust survivors, the Blue Card actually joined forces with Alpha Omega and Henry Schein Cares Foundation to carry out this crucial need. You're going to hear more about Alpha Omega and Henry Schein Cares program today. Again, for those of you who are dentists and dental hygienists, we truly need more volunteers in New York. So please get in touch with us if you are interested in volunteering for this wonderful program. Jewish Federation of North America, thank you for sponsoring this event, launched this Center for Advancing Holocaust Survivor Care on the fall of 2015 to advance innovations in person-centered, trauma-informed supportive services for Holocaust survivors in the United States. The Blue Card, one of many agencies awarded the grant by the Jewish Federation of North America, has further partnered with the Alpha Omega to develop a sensitivity training model for dentists and medical professionals in the industry. And I wanted to pass the microphone to Gail Shupak, Alpha Omega Executive Board Member, International Secretary, and also New York Chapter Treasurer.
Thank you, Radha. Bernice Edelstein, who is really the executive director of the Alpha Omega Holocaust Survivor Program, is unfortunately not feeling well today. So I'm actually stepping in for her. So I'm speaking on her behalf today, but also I'm speaking on behalf of Alpha Omega International Dental Fraternity. And if you're a dentist and you're here and you would like to join, we'd love to have you. And a lot of you were probably members when you were in dental school. Maybe you didn't know that there is a life after dental school as far as Alpha Omega. There is, and we're international. We're all over the world. So I'm going to read what Bernice had written, if you would permit me, and then I'll introduce Dr. Fogelman. This is from her. Thank you, my friends and colleagues, for this opportunity to speak to you today. As many of you know, the Holocaust was the state-sponsored systematic persecution and annihilation of European Jewry by Nazi Germany and its collaborators between 1933 and 1945. Jews were the primary victims. 6 million were murdered. Roma and Sinti, also known as Gypsies, people with mental and physical disabilities, and Poles were also targeted for destruction or decimation for racial, ethnic, or national reasons. Millions more, including homosexuals, Jehovah's Witnesses, Soviet prisoners of war, and political dissidents, also suffered grievous oppression and death under Nazi Germany. Through our Days of Remembrance events, Alpha Omega, the International Dental Fraternity, seeks both to commemorate this tragic history and to reflect on the lessons it holds for our lives today. We also pay tribute to those rescuers who risked their lives to save others during the Holocaust and to the American soldiers who liberated the concentration camps. It is not enough to curse the darkness of the past. We have to illuminate the future, explains Holocaust survivor Estelle Laughlin. On Days of Remembrance, the most important thing to remember is the humanity that is in us all, and to leave the world better for our children and for posterity. It is in that spirit that I invite those of you here today to become affiliated with Alpha Omega International Dental Fraternity and our Holocaust Survivors Oral Health Program. Started in 2015, Alpha Omega and Henry Schein Cares started a program to provide no-cost dental services for Holocaust survivors who are in need. Today, this program has provided dental services to over 500 economically vulnerable Holocaust survivors in 18 metropolitan cities throughout the United States and in Canada. Also, Canada has an incredible amount of Alpha Omegans, and they're very, very active there. There are still many survivors who need dental care, and we are hopeful that those of you in this room today will consider joining Alpha Omega and participating in this impressive program.
Thank you both. Before we begin with the presentations, we would like to ask our speakers to introduce themselves.
Hi, I am a social psychologist and psychotherapist, author, and filmmaker, and you will soon find out how I fit in with people in the dental profession. I have been doing work related to the intergenerational transmission of trauma since about 1976. I started the first groups for children of survivors, the first conference for children of survivors that then led to a whole movement of second generation. I then helped organize the Hidden Child Foundation, which gave hidden children their identity. And also I did a major research project on why non-Jews rescued Jews during the Holocaust and started a foundation, which today is called Jewish Foundation for Righteous, where we were giving monthly stipends to, in its heyday, to more than 1,600 rescuers in 26 countries. I've written books. One of them is Conscience and Courage, Rescues of Jews During the Holocaust. And I wrote and co-produced a film that was on PBS called Breaking the Silence, The Generation After the Holocaust. And I'm working on a sequel.
I am Dr. Morris Sasson. I have a general dental practice in Co-op City, where I have been treating Holocaust survivors for more than 20 years, mostly free of charge dental services. And I'm here to just talk about my experiences with the survivors, and somehow to help other dentists perhaps follow on the same path.
And we have a lot of patients, I can tell you, having referred
I
patients
have patients mostly referred through the Blue Card and Dr. Fogelman, and actually I started with survivors before the Blue Card or Dr. Fogelman, which I will talk about also. And thank you.
Thank you both. Dr. Fogelman will be speaking first, but before she begins, I would like to briefly explain a little about person-centered trauma-informed care so that we are all on the same page. Person-centered trauma-informed care, or PCTI for short, is a holistic approach to service provision that promotes the dignity, strength, and empowerment of trauma victims by incorporating knowledge about the role of trauma in victims' lives into agency programs, policies, and procedures. Basically, through PCTI practices, healthcare professionals can ensure that they will treat their patients in both culturally sensitive and compassionate ways that will make them feel at ease. And this will also help them avoid accidentally triggering them or making them relive their trauma in any way. We believe that PCTI is beneficial for both the client who has experienced the trauma and the healthcare professional who might possibly feel nervous or uncomfortable about working with patients who have been through a traumatic ordeal. It is our hope that this training will help you, in this case the dental professional, be more comfortable working with these clients, especially Holocaust survivors. And by helping you feel more comfortable, your clients will also benefit. And now that I have explained the basics of PCTI, here to explain PCTI care in greater detail is our first speaker, Dr. Fogelman.
First, I want to thank everyone for coming this evening to learn about trauma-informed supportive services and person-centered trauma-informed approaches. You're probably all feeling these days that all you hear these days is PTSD. Trauma here, trauma there, trauma everywhere. People are even complaining that they're being traumatized by the new administration. Enough already. But no, now we have gathered this evening to learn how to introduce trauma-informed care in our health practice. Yes, we are in a paradigm shift that's occurring in dental, medical, and mental health practices throughout the country. Of course, it's easy to understand why mental health workers and doctors have to know how to work with trauma. But why dental providers? Why should you, dentists, dental hygienists, and assistants care? Patients open their mouth, and after taking x-rays, you're pulling teeth, filling a cavity, doing root canal or an implant. Let's face it, how many survivors will be sitting in your chair who had gold teeth extracted without anesthesia in the concentration camps, or were tortured like Laurence Olivier in Marathon Man tortures Dustin Hoffman using a low-speed, dull drill without having administered anesthesia? Dentists, like other medical professionals, have to care because they don't want to re-traumatize a survivor patient. Before I describe trauma-informed care, I'm going to focus on who are Holocaust survivors as a historically traumatized group. What makes them different from other historically traumatized patients we may have, like Vietnam, those from Vietnam, Cambodia, Darfur, Bosnia, Rwanda, African Americans, veterans, unfortunately, to name just a few. So who are Holocaust survivors? And the definition of who is a Holocaust survivor has changed over the years. In 1953, when the German government was giving reparations to Holocaust survivors, their definition was any Jew who was incarcerated in a ghetto or concentration camp for 18 months. So that has changed over the years, both in terms of what the German government gives reparations to and how individuals personally define themselves. So the broader definition today is anyone is considered a Holocaust survivor who lived under the Third Reich or German occupation from January 30th, 1933 to 1945. So that means that Jews who were living in Germany from when Hitler became the chancellor are considered Holocaust survivors. In Austria, we're talking about March of 1938 when the Germans invaded. So that we look at a Holocaust survivor is any from the year that their country was invaded by the Germans. And not only if they were in concentration camps or in ghettos, we're including people who escaped, people who had false identification papers, people who were children. It is interesting that the German government never gave reparations to children because they felt that children did not remember anything, and therefore, if they didn't remember and they couldn't say where they were or where they were hidden or who they were hidden with, if they couldn't remember, then therefore they could not possibly be traumatized by the experience. And that too, by the way, has also changed in terms of the reparations. But there are still Holocaust survivors who, by this broader definition, who may not necessarily identify themselves as Holocaust survivors, even though they are living with the same traumas as those who do identify themselves. And so it becomes a problem when you're trying to figure out who is a Holocaust survivor, which I'll talk about a little later. There is a general fear, of course, going to dentists. Research shows that 1 in 7 Brits would rather endure a divorce than go to the dentist. I always wondered why that was so. Maybe they didn't have enough nitrous oxide. So if so many people are afraid of going to the dentist, why is this different for Holocaust survivors? For one, any sign of illness or weakness meant death or being executed. The natural setting of a dentist, standing over a patient in a chair, has many triggers for re-traumatization. When a survivor is confined to a chair in a dentist's office, he or she loses control. When a dentist gives an order, open your mouth, and the dentist then says, wider, it feels like an order to stand as if one is standing in a roll call. Or you're not standing straight in line. Or Arbeit schneller, work faster. The white coat or another medical uniform is another trigger of associations from the past. So you get the idea in terms of what some of the triggers can be when you have a patient who is a Holocaust survivor. In other genocides, the doctors and dentists did not play as significant a role as it did in the Nazi Holocaust. We have to remember that it was the doctors who were responsible for the killing. Everybody here, I'm sure, has heard of Dr. Mengele. And we have many survivors who remember how they might have had to, pinch their cheeks red so they will look like they were healthy when they didn't feel well. Or they had other people propping them, or people telling them that they're, if it was a child who was 13, they would say, make sure you say you're 16 years old. Otherwise, you're going to go straight to the gas chamber. And so it was the doctors who were the killers. They felt that they were doing the morally correct thing because they were getting rid of people who were responsible for spreading diseases because they weren't clean, because they didn't wash themselves. And so doctors, Dr. Robert J. Lifton, who had interviewed doctors in the 1980s, said that he didn't, I think he interviewed around 30 doctors. Not one of the doctors felt any guilt for the killing that they had done. And of course, you all know about the euthanasia program where it was doctors who wrote, somebody died of pneumonia, somebody died of heart failure, as a way of getting rid of the mentally retarded, the physically deformed individuals. And so this is why for Holocaust survivors, unlike some of the other historically traumatized individuals, it is the doctors and the dentists who can create a re-traumatization more than in the other genocides. So just like that, we all be on the same page. How is trauma defined? There is no universal definition of trauma. The Substance Abuse Mental Health Services Administration, SAMHSA, defines it as, and I quote, individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual being. Trauma is a word that was used first by Sigmund Freud, and he basically described that as any person who is undergoing a situation which is overwhelming to cope with. And in addition to the historical traumas, just to mention a few other traumas that are that we may want to think about as we're working with patients, which is experiencing or observing physical, sexual, or emotional abuse, childhood neglect, having a family member with a mental health or substance use disorder, experiencing or witnessing violence in the community or while serving in the military, poverty, and systematic discrimination. So I think you can see why when, we're talking about trauma here, trauma there, trauma everywhere, we're really covering quite a broad range of people who today are have traumatized lives. Now that we have the background and of the population that some of us are already serving, some of us may want to serve, I would like to talk a little bit about the how healthcare workers can develop a trauma-informed care. Obviously, the first thing is awareness that traumatized patients may need special consideration. And of course, attending this workshop is a first step toward that awareness and the motivation to want to develop a trauma-informed approach to care. Implementing a comprehensive trauma-informed approach involves two things. It involves both an organizational and clinical practice changes that recognize the complex impact, not just on the patient, but also on the caregiver. Sandra Bloom, the creator of Sanctuary Model, has written, and I quote, trying to implement trauma-specific practices without first implementing trauma-informed organizational culture change is like throwing seeds on dry land. Now, the core principles of trauma-informed care. So we have patient empowerment, using individual strengths to empower them in development of their own treatment. Choice, informing patients regarding treatment options so that they can choose the options they prefer. Collaboration, maximizing collaboration among healthcare staff, patients, and their families in organizational treatment planning. So one of the things that you may find with Holocaust survivors, if they are referred by a therapist, if they are referred by their medical doctor, if they are referred by an organization like the Blue Card, self-help that is helping them, or some other social work organization, you may want to all be on the same page and have a conversation with the referring individuals, because chances are the survivor will be going around asking everybody because of their fears, am I doing the right thing? What should I be doing? And so it is helpful to have consultation and collaborations with some of the other people involved with the survivor. And at times, obviously, it's if there is family, it may be a spouse or one of the children. Safety, developing healthcare settings and activities that ensure patients' physical and emotional safety. Trustworthiness, creating clear expectations with patients about proposed treatments entail, who will provide the services, and how will the care be provided. As you can see, we're talking about changing the culture of a healthcare setting so that the senior leader has to lead and communicate about this transformation process. Some of the changes in the organization is, one is, as I mentioned, one of the things you might want to do is even engage patients in, if you're going to do some kind of organizational planning, you might want to send out a questionnaire, or as patients come in, get some feedback from the patients about what they like, what they don't like about the practice, about the setting, and then training clinical as well as non-clinical staff members. For example, training the staff to greet people in a welcoming manner when they first walk into the building, which may help foster feelings of safety and acceptance. Initiate positive relationships. Now, I'm sure all of you know, but sometimes it is the secretary that ends up being more important as to whether a patient is going to come back or not come back, because they may have felt that the secretary was too rough with them, or didn't answer their question, or hung up the phone on them. Inadvertently probably, but the patient felt the phone was hung up on them. So that, again, you want to get everybody in your practice involved in this new awareness and the sensitivity of the traumatized individual. Creating a safe environment. Again, I'm sure that's something you think about not just for Holocaust survivors, but for all your patients, which is keeping the parking lot, the common places, bathroom, and exits well lit. Ensuring that people are not allowed to smoke, loiter, or congregate outside the entranceway. Monitoring who's coming in and out of a building. Keeping noise level quiet in the waiting room. Using welcoming language on all signature. Making sure patients have clear access to the door in the exam room and can easily exit. Okay, now what do we do in terms of the social and emotional environment? And again, I think this is this goes for everybody, which is the welcoming patients and ensuring that they feel respected and supported. So this is very important for Holocaust survivors who feel like victims. Some don't feel like survivors, they still feel like victims. And anything that sometimes said to them, they may feel that they're being, that they may feel like they're being disrespected. Maybe they're speaking with an accent, and the secretary said, "What did you say?" In a way that, I don't speak a good enough English yet. Ensuring staff maintain healthy interpersonal boundaries and can manage conflict appropriately. And of course, when there is Holocaust survivors or anybody else who is anxious when they come to a dentist, one of the things that helps people ward off anxiety is getting angry. So they may say something, and a secretary may say something, and the survivor will start to yell and scream. And what is the secretary supposed to do, or the dental hygienist, or even the dentist, when they're being screamed at? Because obviously it's an unconscious thing that the patient is expressing their anger. How do you calm them down? How do you not get into and engage in this fight? Just in terms of talking about the interpersonal boundaries, which doesn't have to do with Holocaust survivors, although sometimes it may. There are Holocaust survivors who were sexually abused. And so, again, you're in a room. If you have a woman in a chair and you have a man, you may want to have a female dental hygienist there so that the patient feels comfortable. Most women who have been sexually abused in the Holocaust rarely talk about it. Very often, even their own family members may not know about it. Keeping consistent schedules and procedures. If a dentist is late or running late, which I'm sure happens all the time, again, you need to have something explained to the patient that you're going to be running late, or have the secretary say it so that they understand. I try to keep my 45 minutes or hour. Sometimes I'm a few minutes late, and I have had Holocaust survivors already knocking on my door how come I'm not there? I'm not there for them. This is very important, again, because most Holocaust survivors have been abandoned, whether they lost their parents, their siblings, their spouses, their children. And so when a healthcare worker is not there for them on time, it brings up for them feelings of abandonment. Again, this might be, at times it's a conscious thing for them, at times it's an unconscious thing, but they may start erupting. What's going on? Why am I not being taken? And that can create a whole ruckus in the in the waiting room, so that even little things like that become triggers of the trauma that was experienced. Of course, it helps to offer sufficient notice if you're going to be changing anything, maintaining communication that's consistent, open, respectful, compassionate, being aware of how an individual's culture affects how they perceive trauma, safety, and privacy. How do I know if my patient has been traumatized or is more specifically a Holocaust survivor? Some Holocaust survivors you will find wear it on their arm with their number tattooed from Auschwitz. Auschwitz, by the way, was the only place that tattooed its prisoners. Some Auschwitz survivors do not have numbers because towards the end of the war, there were too many people coming in every day to register them daily, and so there was no time. Others came and were relocated immediately to some other place, and they too don't have numbers. Some survivors prefer to remain private about their past, and you may never know. A good idea is when you have a form to fill out for new patients about their medical history, you may want to include a few questions such as, what country were you born in? If not the U.S., when did you come to the U.S.? If it's a European who has come after 1945 or between 1933 and 45 from Germany, and after 38, I mentioned from Austria, you can assume they are survivors of some sort. You do not have to be, you don't want to be intrusive. The dates from other countries who underwent genocide will also give you a clue. There are also trauma screening scores from questionnaires like ACE, and you can have a question asking, are you a veteran of any war? If yes, which one? You can have an open-ended question at the end. Is there anything else the doctor or dentist should know about your personal or family history? And leave a few blank lines for an answer. Now, one thing that we often don't think about, which is preventing secondary traumatic stress in the staff. You may want to begin by training staff to about awareness of secondary traumatic stress, offering opportunities for the staff to explore their own trauma histories, supporting reflective supervision where worker meets with a supervisor to discuss how they feel about their interaction with the patients. You know, when you have a Holocaust survivor and let's say they really irk you, but you feel, well, they're a Holocaust survivor. I can't possibly say anything. If it was, you know, somebody else, I'd be able to say, you know, keep quiet in the waiting room or, you know. But, you know, you don't want to hurt the Holocaust survivor. How does that make the worker feel that they can't do what they're supposed to do? Or how does the secretary feel if the survivor is calling every day, can I talk to the doctor? Well, the doctor's seeing patients. And how do you keep your cool when the survivor is calling every day, you know, are my x-rays ready? Or when is my bridge going to be ready? At times, you may want to allow a mental health day off for some of your workers, or you know, possibly suggest yoga, meditation. And when you hire people, you may want to ask them what it is they know about trauma-informed care. So as I had mentioned, involving, particularly with the Holocaust survivors, you don't want to tell them what you're going to do. You want to discuss with them what you plan on doing, how they feel about it. So sometimes you may need to spend a little extra time explaining things so that they feel that they too are somewhat in control. And as I mentioned earlier, engaging some of the referral sources and partnering with some of the organizations. At times, it's helpful for patients to know that their trauma may be the cause of some of the dental problems they're having. For example, one of the things that you will find, and that's going to be recurring more as the years go by, is that many of the child survivors have very poor gums. And for you to explain that part of the reason they have that is because they had malnutrition during the most important formative years of their development. They may not like what they're hearing, but at least they will feel, gee, I didn't cause this to myself, you know. And that's sometimes helpful to understand what is going on. So, in talking about all of this, I wanted to give you the numbers of what is it that we're talking about, and why is this so important, particularly in New York. We're talking about a fairly large population. Right now, we're talking about anywhere from 100 to 130,000 Holocaust survivors who live in the New York area. 25% of them are below the poverty level. Amongst the former Soviet Union population, about 50% are below the poverty level. Now, you may be thinking the fact that most of these people are, the youngest people today are 71, 72. So the majority of the population we're talking about are between 80 and 89. That's like about more than 80% of the people are between 80 and 89, and then between 90 and 99, you have about 20% of the people. So you're wondering, I mean, this is a dying population. How can it possibly be increasing in needing services? And one of the reasons that is the case is because we have the Russian population, which came here in the 1980s and 1990s, are a totally new population. There are also many survivors who, as I mentioned earlier, did not identify as being Holocaust survivors, and now they are identifying as Holocaust survivors. So that's again an additional group. And we've also had more recent immigrations of people coming from from other Eastern European countries. We now have people coming from France that are leaving France who are also Holocaust survivors. So that you can see that indeed we are talking about a population that is going to need very intensive dental care. I'd say probably for for the next 10 years or so. I think you can understand now the paradigm shift that we're experiencing now in the healthcare providers. Trauma is a public health issue that's transforming healthcare systems, and by adopting this approach, you will be doing a great service not only to the Holocaust survivors, but to all traumatized patients, past and future. Thank you.
Thank you very much, Dr. Fogelman. Before we have our final presentation, we would like to ask a few more poll questions.